Currently 6-0. We'll place that bill on call. Who is here?
Wood has another.
Oh, you have another one? Which item?
24. Yes,
3 more.
3 more, okay. AB 2024, Critical Access Hospital Employment. Number 10?
Yeah, 10 and then he has.
14.
Thank
Please proceed.
Thank you, Senator and members. AB 2024 permits critical access hospitals to employ physicians in charge for their professional services. Critical access hospitals are also referred to as frontier hospitals because most of them are located in remote rural areas. There are 34 such hospitals in the state, and they all have 25 or fewer beds. While these hospitals are small, they provide critical services and value to the communities in which they are located. Without these hospitals, residents of these communities often need to drive many, many miles before reaching another hospital. As I was running for office, one of the issues I heard throughout my district was the challenges these hospitals face in attracting physicians. I have 6 of these 34 hospitals in my district. This difficulty has been echoed by many of my colleagues, and that is the reason many of them have joined me as co-authors on this bill. I believe 2024 is a modest bill and provides a limited exemption for those hospitals most at risk of closing their doors if they cannot address their physician staffing needs. This bill calls for a sunset in 7 years and a report by OSHPD on the impact of this exemption of on the hospital's ability to recruit and retain physicians. After amendments clarifying the role medical staff will play in the hiring of physicians, the California Medical Association is now neutral and the bill has no opposition. I respectfully ask for your aye vote, and I have witnesses in support.
Thank you. Please proceed.
Chairman and members, Barbara Glazer on behalf of the California Hospital Association. We're here today in support of the bill. As the Assemblyman has pointed out, these are the smallest, most isolated hospitals in the state, and this will be an excellent tool for them to not only recruit physicians to the area, but to keep them in the area and improve access to health for the communities they serve.
Thank you. Anyone else?
Amber King with the Association of California Healthcare Districts. 20 of the state's 34 critical access hospitals are district hospitals. We were the sponsors of the original pilot program in 2003. Those hospitals that did employ physicians, it was very successful. Unfortunately, once the pilot program did expire, those physicians left the area and are no longer there. So this guarantee of employment is very important for those rural areas, and we urge your aye vote.
Thank you.
Catherine Austin Scott with the District Hospital Leadership Forum in support.
Thank you. Anyone else?
Pam Law with Health Access in support.
Tiffany White and SEIU California in support.
Mandy Lee on behalf of Sutter Lakeside Hospital in support.
Fred Notwer in support on behalf of the Alliance of Catholic Healthcare, Loma Linda University, and the Alliance and the Adventist Health System. Thank you.
Thank you.
Doug Chiapetta on behalf of the Union of American Physicians in strong support.
Dylan Gibbons with the California Special Districts Association in support.
Thank you. Anyone else? Opposition? No opposition. Questions, comments from any of the members? Senator Nielsen.
Assemblyman Wood, if you have occasion to amend, I'd appreciate adding as a co-author.
An honor. Thank you, Senator.
There's no amendments today, right? We may have to do it in the next committee because there's no amendments here in this committee. Senator Wood, do we have a motion? Oh, moved by Senator Nielsen. Does somebody else have a question, comment? Okay. Senator Wood, I thank you for bringing it forward. As you know, we've always had that discussion about access, workforce. There's truly a need, and would you like to close?
Respectfully ask for your aye vote.
Thank you. Item number 10, AB 2024, due pass to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Roth. Wolk. Wolk, aye.
Currently has 5. We'll place that bill on call. We have your item number 14, AB 2207, Medi-Cal Dental Program.
Thank you, Senator and members. I present AB 2207, which makes substantial improvements to California's Denti-Cal program. Numerous reports, including those published by the California State Auditor, the Federal Office of the Inspector General, and the Little Hoover Commission have highlighted the challenges with our broken Denti-Cal system. In 2014, almost half of eligible Californians did not receive the dental care they were eligible for. Additionally, dentists report that low reimbursement rates and slow, outdated, paper-based administrative and billing processes hinder provider participation and impede access to care. AB 2207 will streamline the enrollment process for providers, ensure that provider networks are up to date so that beneficiaries can more easily access providers, improve coordination of care for beneficiaries, and increase DHCS oversight of the DentalCal program. I accept the amendments as discussed in the analysis and thank the committee staff and the chair for your work on this bill. I have with me today Kathy Dressler with the Children's Partnership and Carol D'Elia with Little Hoover Commission testifying in support of the bill.
We do have support on both sides. Please proceed.
Good afternoon. This is Kathy Dressler from the Children's Partnership. Tooth decay is the most common chronic disease and unmet health need of children in California and accounts for persistent pain, missed school days, and expensive emergency room treatment. Over 500,000 kids, 5.6 million, are enrolled in Medi-Cal, but as the Assembly member just mentioned, fewer than half of them saw a dentist the year that the state auditor did their report in 2014. AB 2207 will streamline the processes for enrolling and disenrolling providers, so it makes it easier for parents to find a dentist that accepts Medi-Cal in order to get their children in. It will help us to track progress forward as we collect essential data that we'll need in order to move forward. Thanks.
Anyone else?
Good afternoon, Chair and committee members. My name is Carol D'Elia. I'm Executive Director of the Little Hoover Commission. Last year, Senator Pan and Assemblymember Wood asked the Little Hoover Commission to take a look at the DentalCal program. This request came on the heels of the Bureau of State Audit report, and we took up the challenge and came out with recommendations and findings in an April report simply titled Fixing DentalCal. The Commission has studied many bureaucratic breakdowns in its 54-year history, but this has to be one of the worst that we've ever seen in terms of the mutual hostility between the state and the dental profession and the justifiable aggravation of the stakeholders, the patients, the parents, when folks can't get the dental care that they need. It was alarming that 13 million Californians who are part of this program, 5 million of those children, half of the children in the state of California are part of this program and are suffering because the promise of dental coverage by the state is not being fulfilled. Our commission called it a vicious circle of dysfunction where dentists don't want to participate in the program, parents and children can't find dentists, so they don't go to the dentist. Their tooth decay worsens. Rather than getting preventative treatment, they wind up with expensive restorative care. 86% of the budget goes towards restorative care. As we've heard, as the dentists see it, terrible reimbursement rates and a lot of bureaucratic red tape. Difficult administrative procedures that compare very poorly with what they're used to in the commercial sector. In the commercial sector, you can go online, fill out your paperwork, and be part of the program in a matter of days. In DentalCal, you have a 22-page plus paper form, which you have to hand fill out, stick in the mail, and maybe in months you'll be part of the program. Commercial insurers trust dentists to do what's necessary, whereas the state requires a lot of pre-authorizations and often denies. Billing is difficult and slow. So I won't belabor all of the points of the bureaucratic red tape, but AB 2207 addresses many of these bureaucratic inefficiencies that keep dentists out of the program. If enacted and implemented, the bill will achieve the Commission's goal of expanding access to care. Thank you, and I urge an aye vote.
Thank you. Anyone else in support? Name and position.
Linda Way with Western Center on Law and Poverty. We want to thank the author for taking our suggested amendments and are in strong support.
Brenda Diaz with California Coverage and Health Initiatives and the Children's Coverage Coalition in support.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network and the Having Our Say Coalition in support. Tam Ma with Health Access and strong support.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Judy Darnell with United Ways of California. We're in strong support.
Delilah Clay on behalf of Western Dental, which provides services to more DentalCal members than any other provider in the state, in strong support.
Michelle Gibbons with the County Health Executives Association in support.
Opposition? Questions? Comments? Senator Pan?
Well, thank you. I just want to thank you, Senator Wood, for your leadership, and it was great to partner with you. And I want to actually thank the Little Hoover Commission for their hard and diligent work on this issue. I'm glad to see we're taking on the recommendations. And with that, I'd like to move the bill.
We have a motion. Would you like to, oh, sorry, Senator Nguyen.
Thank you. Mr. Chairman, I'm very supportive of the bill. It's the right thing, and I really thank you for your leadership on this, because it is the right thing to do, and we definitely need to expedite the process. But while we're expediting the process, do you see a lack of not enough dentists in the program to be able to help? You know, I mentioned earlier, my other is that, you know, I want the individuals who needs the Denti-Cal gets in the system ASAP, but do we have enough dentists to make sure that that system doesn't collapse either? You know, because I actually even, and I'm not on Medi-Cal, but it takes me 2 months to get an appointment, if not 3 right now. and then now my dentists they're not even open on Friday for certain services, and that's the only time I can take my children because I'm back on Friday. So I'm kind of stuck until, you know, summer recess or sessions out is when I can take my children to the dentist or start looking for a new one, and that's probably the route that I'm going to be going into. You know, but that's the thing is there other options that we can help to ensuring that we can get more dentists into the system, you know, than where we are today?
Well, I think the problem is multifactorial. I think one of the big issues, and I'm a dentist, and I took Denti-Cal patients, and quite honestly, if I could have avoided some of the frustration I had with the billing and some of the other issues I had with the system, I would have taken a lot more. It's very difficult when you're reimbursed 30 cents on the dollar when your overhead is 72 cents on the dollar to accept that. I did that as part of my calling as trying to take care of people. Every Denti-Cal patient I saw, I lost money on. What I was just trying to do was to get what was owed to me by the state, and it became very, very difficult. So until we have a better, you know, increased reimbursement rates, we're still going to struggle with this. But if we can cut some of the red tape, I know a lot of my colleagues would gladly take Medi-Cal patients, and so it is absolutely frustrating that in this day and age that we're still dealing with paper-based application systems, out-of-date provider networks, and a system that just is quite frankly dysfunctional and broken.
And we can continue to fight for better reimbursement rates too.
I'd love if you could. Thank you.
Thank you.
Thank you. Is there a motion? Somebody already moved by Senator Pan. Again, Senator Wood, appreciate the policy. Obviously, I'm going to support it. Call the members. We're at item number 14, AB 2207. Do pass as amended to appropriations. Call the members. Would you like to close?
Respectfully ask for your aye vote. Thank you.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
That currently has 7. We'll place that bill on call, and you're now on item number 16, AB 2260. That does have support on both sides.
Thank you very much, and I'll be brief. Thank you. Emergency services providers such as ambulances are required to provide specified information to local emergency service authorities, or LEMSAs. As most of you know, I represent the North Coast, which encompasses a very large area of Northern California. Due to the geographic remoteness of my district, air ambulance play a crucial role. The lack of consistency in data reporting requirements across the various LEMSAs presents serious challenges for air ambulance providers. Air ambulances may take off from one LEMSA jurisdiction, pick up a patient in a different one, and deliver to a third. They have to provide a report for each one of those landings. It's not uncommon for a single helicopter to operate in the majority of California's 33 LEMSAs over the course of a single year. Each of these LEMSAs may require the air ambulance provider to submit different data in different formats. We're simply asking to develop a standardized and consistent data set that air ambulance providers will submit to LEMSAs. It will ensure a single submission standard and eliminate the duplication among LEMSAs. I respectfully ask for your aye vote, and I have a witness here in support.
Thank you. Please proceed.
Hi, Catherine Austin Scott, representing the California Association of Air Medical Services. I think the author did a great job of explaining the bill. Again, this is to standardize the report so that the same data isn't asked for in 3 or 4 different formats by 3 or 4 different LEMSAs. So we ask for your support.
Thank you. Opposition? Questions, comments? We have a motion by Senator Wolk, and would you like to close?
Respectfully ask for your aye vote.
Thank you. And item number 16, AB 2260, do pass to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn, aye. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye. 7-0.
Currently has 7. We'll place that bill on call.
Thank you very much, Senators.
Open the roll call? I'll open the roll call. I'll open roll while we're waiting. On those that we've done already? Let's see. Yeah, since we're waiting, let's just open the roll for the votes.
He can, I can tell her which ones,
Yeah.
and then you just take it down.
We're going to have to do it anyways later, since some of those who missed it. Since we're waiting for, oh, well, we do have.
We have an option.
Well, you know, actually, why don't we go ahead and open the roll? We're going to open the roll call for the other votes. Give us a few minutes. Item 1, AB 38.
Hall. Nielsen. Nielsen, aye. Roth. Wolk. Wolk, aye. 7-0.
7-0. We'll keep it on. We'll keep it open. Item 2, AB 1668.
Mitchell. Roth. Wolk. Wolk, aye.
Thank you. I'm just going to open
7-0.
real quick, if that's possible. One, number 3.
Item number 3, AB 1696, Holden, call the absent members.
Wynn. Wynn, aye. Roth. 7-1.
7-1, place that bill on call. Item number 4, AB 1763, call the members.
Wynn. Roth.
6-1, we'll place that bill on call. Item number 6, AB 1831, call the absent members.
Wynn. Wynn, aye. Roth. 8-0.
8-0, we'll place that bill on call. Item number 7, AB 1863, call the absent members.
Wynn. Wynn, aye. Hall. Roth. 7-0.
7-0, place that bill on call. Item number 10, AB 2024, call the absent members.
Wynn. Wynn, aye. Hall. Pan. Roth.
6-0, place that bill on call. Item number 13, AB 2079, call the absent members.
Wynn. Wynn, no. Roth. 6-2.
6-2, place that bill on call. Item number 14, AB 2207, call the absent members.
Hall. Roth. 7-0.
7-0, place that bill on call. Item number 16, AB 2260, call the absent members.
Hall. Roth.
7-0, place that bill on call. Item number 20, AB 2821, call the absent members.
Wynn. Wynn, aye. Hall. Roth.
7-0, place that bill on call. We're now at item number 8, AB 1954, Burke Healthcare Coverage, Reproductive Healthcare Services. Welcome.
Thank you, Mr. Chair and Senators. I first want to thank you and your staff for the time you've taken on the bill, and we have mock-up of technical and clarifying amendments that address the issue raised in the analysis, and it's being passed around to you now. For many women, reproductive health care is primary care. Nearly 3/4 of women of reproductive age in the nation receive at least one sexual or reproductive health service each year. While some health plans allow direct access to a reproductive health care provider, others require patients to first get a referral from their primary care physician. The variation in policy has created a patchwork of coverage and access to care. AB 1954 builds on the current state and federal law by prohibiting referral requirements for in-network reproductive health care. By removing the unnecessary administrative barriers that cause delays in care and leveling the playing field across health plans, Californians will have more equitable access to time-sensitive reproductive and sexual health care services. I respectfully request it. I vote.
Thank you. Anyone in support?
Yes, hi, good afternoon, Mr. Chairman and members of the committee. My name is Sylvia Castillo. I am with California Family Health Council. CFHC champions and promotes quality sexual and reproductive health care services for all. And we administer the federal Title X family planning program in the state of California that supports the delivery of quality family planning services to nearly 1 million men, women, and teens each year at over 340 health centers statewide. CFHC is proud to co-sponsor AB 1954, along with California Latinas for Reproductive Justice, Black Women for Wellness, and NARAL Pro-Choice California. And we thank Assemblymember Burke for her leadership on this important measure for men, women, and teens. AB 1954 is a straightforward, common sense legislation that seeks to eliminate the unnecessary burdens that create barriers to timely access to these sensitive services. The bill seeks to offer a simple yet impactful policy innovation, allow enrollees in commercial health plans to obtain direct access to reproductive and sexual health services. As the Assembly member mentioned, AB 1954 was developed to level the playing field and ensures that equal and direct access for all women and men seeking these services, including family planning, STD testing, and treatment, as well as abortion care. The measure recognizes that direct access should be available to men and women, and it also focuses on this time-sensitive services received and not the provider type. Individuals across the state are obtaining these services from various licensed provider types, including family practice physicians, nurse practitioners, physician's assistants, and certified nurse midwives. Requiring referrals also triggers potential confidentiality concerns that lead to further delays in obtaining care. For women specifically seeking abortion services, referrals delay them from receiving the time-sensitive information and services that they need. When it comes to sexual and reproductive health care, every day, week, and even every hour counts. This bill continues California's long history of leadership and commitment to breaking down barriers to reproductive health access and saving public dollars along the way. For these reasons, we strongly urge you to vote yes.
Thank you. Anyone else? Support?
My name's Eileen Schnitger. I'm the Director of Public Policy for Women's Health Specialists of California, and I'm here representing the 39,000 people that come to our 9 clinic sites across California for sexual and reproductive health. And I want to share today 2 experiences of clients who had barriers to be able to use their health plans for covered services. Maria called Women's Health Specialist phone counselor to make an appointment for a birth control visit. She had private insurance and she was unable to obtain an authorization for contraception. So Women's Health Specialist called to verify her coverage, and her health plan stated that a subscriber must get a referral to be able to seek care outside her primary care provider. So Women's Health Specialist instructed Maria to call her primary care for a referral. Her PCP's office refused to give her a referral, stating that the PCP was morally opposed to birth control. Grace's mother called Women's Health Specialist for an appointment for her daughter to have an abortion. I spoke to Grace directly to see that she wanted to come in and wanted us to go ahead and verify her health insurance, and she said yes. her mother gave her insurance information to us to verify. Grace was nearly 14 weeks from her last menstrual period at that time. Her private health plan would not cover her abortion without a referral from her PCP. Our insurance specialist contacted Grace's health plan daily and being referred from one department for another to find out what she could be done so she could get a referral to use her insurance. It took a week and a half for her plan to be able to find another physician to give her a referral. So Grace was nearly 16 weeks pregnant and had to drive from Chico to Sacramento, but she was finally able to have an abortion. So for these reasons, I asked Chair Hernandez and the committee members to have an aye vote on 1954. Thank you.
Thank you. Anyone else in support? Name and position.
Catherine Austin Scott, representing the California Academy of Physician Assistants.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Dennis Cuevas Romero, here on behalf of the California Latinas for Reproductive Justice, proud co-sponsors of the bill. Thank you.
Megan Brightwell on behalf of California Health Plus Advocates in support.
Angela Blanchard on behalf of NARAL Pro-Choice California, co-sponsors of the bill. Proud to support.
Shannon Smith Crowley, American Congress of Obstetricians and Gynecologists for California in support.
Christina Romero, Planned Parenthood Affiliates of California in support.
Chris Rosa on behalf of BEAR in support.
Thank you. Opposition?
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies. We'd like to thank the author and sponsor for working so diligently with us. We're reviewing the amendments, but we expect to be removing our opposition going forward.
Jennifer Alley with California Association of Health Plans. The same, we're reviewing the amendments and we expect to remove our opposition. Thank you.
John Winger on behalf of America's Health Insurance Plans. We echo those comments.
Thank you. Questions, comments? We have a motion by Senator Monning. Would you like to close?
I respectfully request an aye vote.
Thank you. We're at item number 8, AB 1954, due pass amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
6-0. It is 6-0. We will place that bill on call. Thank you.
I have this. Can we do my next?
And we're at item number 12, AB 2077, Healthcare Eligibility, Enrollment, and Retention Act.
Thank you, Mr. Chair. Members, again, I thank you and your staff for their work on this bill, and the sergeants are distributing a mock-up of the amendments that are outlined in the analysis on page 6. AB 2077 ensures that Californians transitioning between Medi-Cal and Covered California retain coverage between plans. We've made a lot of progress in providing affordable health care coverage. With more Californians eligible for coverage, we're seeing more transitions between Covered California and Medi-Cal coverage as their income fluctuates. Although current law promises transition between Medi-Cal and Covered California without a break in coverage, consumers are having difficulty keeping coverage when their eligibility changes. AB 2077 eases the transition between plans for those moving from Covered California plans to Medi-Cal and vice versa. By providing a coverage bridge for Californians transitioning between plans, we can make sure that no one falls through a coverage gap. I respectfully request an aye vote.
Thank you. Anyone in support? We do have, believe, support on both sides.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, pleased to sponsor this bill and appreciative of the Assemblywoman's leadership on the issue. When Dr. Hernandez and Dr. Pan and others did the special session bills in 2013 to implement the Affordable Care Act, part of the vision of Obamacare was supposed to be no wrong door, that people could apply for coverage and the state would decide what they're eligible for. And this legislature also passed a requirement that people move between the programs like Medi-Cal and Covered California without a break in coverage. Unfortunately, that's not the reality for people on the ground. We have folks whose income goes up or down and they're falling into the coverage gap between Medi-Cal and Covered California. We do need to put some steps in place to make sure people aren't falling through the cracks, and we urge your support. Thank you.
Any other witnesses?
Good afternoon, Senators. Liza Thanchanon with Legal Services of Northern California. Our office works regularly with individuals who are harmed when transitioning between programs, particularly when they experience a break in coverage and have urgent medical needs. AB 2077 would improve the transition process, and we're in support. Thank you.
Tam Ma with Health Access and Support.
Brenda Diaz with California Coverage and Health Initiatives in support.
Judy Darnell, United Ways of California, support.
Kathy Dressler from the Children's Partnership in support, also speaking on behalf of the Children's Defense Fund of California and Children Now, also in support.
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Rebecca Gonzalez, National Association of Social Workers, California, in support.
Tim Gibbs, American Cancer Society Cancer Action Network in support.
Jasmine Gordon, the California Black Health Network in support.
Fred Notwer, representing the private essential access community hospitals in support.
Eileen Schnitger, Women's Health Specialist of California in support.
Any other support? Any opposition? Any questions? There's a motion. Would you like to close?
I respectfully request and I vote.
Thank you. Please call a roll.
Do pass as amended to
Pass as
appropriations.
amended. Thank you. Do pass as amended to appropriations.
Hernandez. Nguyen.
Aye.
Nguyen, I. Hall. Mitchell. Monning. Monning, I. Nielsen. Nielsen, I. Pan. Pan, I. Roth. Wolk. Wolk, I.
It's 5-0. We'll keep it on call. Thank you. Well, while we're waiting, why don't we open the call for consent calendar then? That's for item 5, AB 1823, item 11, AB 2053, and item 17, AB 2279. Please call roll.
Nguyen. Nguyen, I. Roth.
And we'll keep that on call. Thank you. Have we called, can we call, we have McCarthy, we have 9, 18, and 19, right? Can we call the members?
15.
18 and 19.
I'm sorry, okay, okay. Did they call? So, 9.
Call the roll on 8, I voted wrong on that.